They work in hospitals in London, clinics in New York, emergency rooms in Riyadh, and care homes in Tokyo. They are there during a patient's first breath and sometimes during their last. They hold hands when families cannot. They comfort in silence, listen without judgment, and work hours that would break most people. Filipino nurses are everywhere, and the world trusts them more than anyone else. But what makes this trust so strong? Why, regardless of language, culture, or geography, do Filipino nurses continue to earn the respect and admiration of patients and healthcare systems around the world? The answer lies in a unique mix of history, culture, skill, sacrifice, and heart. Let's begin with the roots. The Philippines has a long legacy of nursing, one that traces back over a century. When the United States colonized the Philippines in 1898, one of the first areas they restructured was public health. American doctors and missionaries built hospitals and introduced Western-style nursing schools. Filipino students were taught in English using American medical standards. This early exposure built a healthcare foundation that was not only skilled but globally compatible. Filipino nurses could easily transition into hospitals abroad because their training aligned with international requirements from the start. By the mid-1900s, especially after World War II, the demand for nurses exploded in countries like the United States. The Philippines responded. Nursing schools expanded rapidly. For many Filipinos, becoming a nurse became more than a profession. It became a ticket to opportunity, a way to support families back home, and a symbol of pride. Over time, the global image of the Filipino nurse began to take shape. Hardworking, humble, reliable, and deeply compassionate. But history is just one part of the story. The cultural values of the Filipino people are what truly elevate their approach to caregiving. At the heart of Filipino culture is the concept of malasakit. There is no direct English translation for it, but it combines empathy, care, and deep personal concern for others. It means going the extra mile not because you are required to, but because you genuinely care. When a Filipino nurse enters a room, it is not just to administer medicine or check vitals. It is to make sure the patient is okay as a person. They will ask how you are, remember your favorite food, share stories, offer a smile even after a long shift, and sometimes even pray with you. In many ways, they become more than just caregivers. They become emotional lifelines in some of the hardest moments of people's lives. Another powerful value is pakikisama, or harmonious social interaction. Filipino nurses are known for their ability to blend in, adapt, and build warm relationships quickly. Whether they are working with patients, families, or foreign colleagues, they bring a natural friendliness that eases tension and builds trust. In emotionally charged environments like hospitals, this quality makes a world of difference. It also helps that English is widely spoken in the Philippines. From grade school to university, Filipinos are taught in English. This makes it easier for nurses to integrate into English-speaking healthcare systems, follow instructions accurately, document clearly, and communicate with patients directly. In many countries, this removes one of the biggest barriers to care, language, and patients' notice. But it is not just about language. It is about presence. Filipino nurses are known to be calm even in chaos. They stay grounded during emergencies. They think quickly but act gently. Many hospital administrators have described them as emotionally intelligent. They understand when to speak and when to just listen. They sense when a patient needs space and when they need comfort. That emotional sensitivity is rare, and it does not come from textbooks. It comes from the way they were raised, from family values passed down through generations. Then there is the work ethic. Filipino nurses are known to take on long shifts, fill in for colleagues, and never complain. They are often praised for being dependable and committed. Behind this dedication is often a deeper motivation: their families back home. Many Filipino nurses working abroad are overseas Filipino workers, or OFWs. They leave their country, their children, their parents, and sometimes their spouses to earn better wages abroad. Every syringe they prepare, every patient they bathe, every night shift they endure. They are doing it not just for their patients but also for their loved ones thousands of miles away. This sense of sacrifice is something the world respects. It is hard to describe the pain of missing birthdays, anniversaries, graduations, and holidays. But Filipino nurses carry that burden quietly. They smile through the homesickness. They bring light into rooms even when their own hearts feel heavy. That resilience is powerful and patients can feel it. Healthcare systems around the world have taken notice. Countries like the United States, the United Kingdom, Canada, Germany, Japan, and many others have actively recruited Filipino nurses for decades. Some have created fast-track visa programs just to bring them in quicker. Hospitals have written testimonials praising their Filipino staff. Patients have shared stories about the nurse who stayed with them all night, who held their hand during surgery, who became family during their most vulnerable days. One story that stood out came from a cancer patient in Los Angeles who said, "My Filipino nurse didn't just take care of me. She cared for me like I was her own daughter." That kind of connection cannot be taught. It is something deeper. It is a blend of soul, service, and sincerity. Filipino nurses are also incredibly adaptable. They work in world-class hospitals with cutting-edge technology, but also in rural clinics with limited supplies. Whether it is a private hospital in Dubai or a care home in Italy, they find ways to do their job with compassion and skill. They adjust to different accents, protocols, religious norms, and food, without losing their sense of self. Another reason they stand out is their sense of community. Filipino nurses support one another abroad. They form networks, share housing, mentor newcomers, and create a family away from home. This solidarity helps them survive the emotional toll of the job. It also builds stronger teams in hospitals. A connected, supportive nursing staff creates a better environment for patients. But being a Filipino nurse abroad is not easy. Many face discrimination, underpayment, and burnout. Some are overworked because of staff shortages. Others feel invisible in countries where they are just seen as labor. Yet despite these challenges, they keep going. Not because they are invincible, but because they are deeply committed to the people they serve. The Philippines also continues to produce high-quality nursing graduates every year. Nursing schools in the country are often internationally accredited. Students undergo rigorous training and clinical rotations. Many nurses spend months, even years, preparing for exams and certifications needed to work abroad. This dedication to education ensures that they arrive in other countries well prepared. During the COVID-19 pandemic, the role of Filipino nurses became even more visible. They were on the front lines in overwhelmed hospitals. They worked in ICUs, emergency rooms, and isolation wards. Some got sick. Some lost their lives. But countless others stayed day after day, comforting patients who were dying without families by their side. The world watched and saw not just professionals, but heroes. Even now, long after the peak of the pandemic, many hospitals continue to depend on Filipino nurses to fill their staffing gaps. In fact, the demand is growing. Countries with aging populations need more caregivers. And more often than not, they want someone with heart, patience, and warmth. Someone like a Filipino nurse. So when people say the world trusts Filipino nurses more than anyone, it is not a compliment. It is a truth built over decades of service, sacrifice, and sincerity. It is a result of thousands of small moments that happened quietly in hospital rooms, nursing homes, and patient bedsides. Moments that were not caught on camera, but changed lives. It is in the nurse who sent half her salary home so her siblings could go to school. It is in the nurse who held a stranger's hand while they passed away. It is in the nurse who worked the night shift, then attended Mass in the morning to pray for her patients. These are not just workers. These are caregivers shaped by culture, forged by hardship, and driven by love. The next time you find yourself in a hospital and a Filipino nurse walks in, know that you are in good hands. Not just because they are skilled, but because they care. Truly care. And if you are someone whose life was touched by a Filipino nurse, remember to say thank you. Behind their quiet smile is a world of strength you may never fully see. If you enjoyed this video, please give it a like and subscribe to the channel. We have more powerful stories just like this, so be sure to check out our other videos. Thank you for watching.